Hello everyone, this is Suyesh here. Okay, now so in this video we are in the section of our mediastinum, the new topic mediastinum anatomy. So we will be having two videos for this, and the first video will be the divisions and the classification of mediastinum into different parts, and the second will be the contents of different parts. Okay, so mediastinum is just like you can say you have learned about cubital fossa, popliteal fossa. They are also having the boundaries. Okay, and they are also having contents. So like this, mediastinum is also having contents, okay, and boundaries. So it is like just like a same space which is present, okay, in our body. Like we have cubital fossa, we have anatomical snuff box, we have popliteal fossa. So like that, it is also space between inside our thoracic cavity. Okay, so it is actually present. It is actually present between two pleural cavities. It is a space you can say present between two pleural cavities. Okay, so what does it mean by pleural cavities? So you know that they're between lungs, this is lungs, so between them there is a space. Okay, so the sternum is present. So under sternum, from anterior to posterior, there is a space between two lungs, and that space is actually called as mediastinum, and in language we say it as space present between two pleural cavity. Okay, so it is a space present between two pleural cavity, and it is actually present in thoracic cavity. Okay, so first of all, you can say you can see this diagram. Okay, so you can see this is your sternum. Okay, so it is actually a lateral view. If you are seeing a person from lateral side, okay, you can see these structures like this. You know that posteriorly is a vertebral column. So it actually these are the vertebra from level of T1 to T12. Okay, so, and this is your thoracic inlet, the superior border of your thoracic, where your thoracic means from where your thoracic cavity starts. So this is actually a thoracic inlet. Okay, and this was your sternum. So sternum is actually anterior, you know that, and just lateral to them there is lungs. So it is actually the space just posterior to your sternum from anterior to till the vertebral column. So it is actually present, you can say, in like a transverse line, you can say, from the sternum till the posterior side till the vertebral column. So it is actually the space present between two lungs, okay, like this, and it is going from the anterior side. This one is your anterior side, just consider, and just like this is going to the posterior side. Okay, so here the pen, this is the posterior side, and this is your vertebral column, and here it is your sternum. So like this, okay, like this, there is a space from anterior to posterior side. Okay, so this space you can see actually from the lateral side, and this two space from the sternum till the vertebral column is present between two lungs, like this. So from anterior to posterior. Okay, so this much is clear. So this is actually the diagram. You can see in this same visual appearance, you can see what I have told just before. Okay, so this is sternum, this is a vertebral column, and between them there is a space, and the space is actually between the two lungs, okay, the two pleural cavities. Okay, so this is the sternal plane. Okay, so this plane, you can see, this is actually called as a sternal plane. This is called as sternal plane. Okay, or you can say transverse thoracic plane, you can also say, because it is transversely. So it is transverse thoracic plane. Okay, and this, you can see this yellow part is actually your pericardium, the outer covering of your heart. Okay, so this is actually your pericardium. This is actually your pericardium. Okay, and just inferior part, you can see this one is actually your diaphragm. Okay, and these are your vertebrae from level of T1 to T12. Okay, so this is thoracic cavity. So now we have to see the classification, actually the divisions. So we have actually two classifications. First is the you know that there is trachea and the pulmonary trunk, okay, will be present in the center. Just consider, because the trachea is most anterior, esophagus is most posterior, you know that. It is just at the level just anterior to your vertebral column, and just posterior to your sternum. First of all, there will be trachea. There will be, like, you can say, there will be arteries of your heart, like aorta will be there, pulmonary trunk will be there. So on the basis of them, that is pulmonary trunk, the posterior part of your pulmonary trunk, and trachea will divide this thoracic, actually not thoracic, your mediastinum, into two parts. Okay, so on the first classification, on the basis of division, on the posterior, first on the posterior side of pulmonary, trunk, and trachea. So it will be dividing these two parts into dividing this classification will be dividing this mediastinum into two parts. So first will be your anterior mediastinum, okay, and second will be your posterior mediastinum. Okay, so you can actually see, just draw a line, okay, like this. Just consider this is a line, okay, and your trachea is here. Okay, we are seeing this laterally. So trachea's posterior part will divide this mediastinum into two parts. So the which is present just here, this is left to this line will be your anterior mediastinum, and which will be present just posterior to them, posterior to this line will be your posterior mediastinum. So this is the first classification. So it is also a classification, but the major classification is on the basis of that is into superior and inferior. That is called as clinical classification. That classification we use actually in the X-ray imaging, when we see the X-ray of chest or lungs laterally to check the mediastinal space or mediastinal pleura. So that at that time we use that classification. So we are going to see that classification also. So this classification is actually called as clinical classification. Okay. So now in this diagram it will be clear how it is divided. Okay. First of all, mediastinum. I will writing mediastinum. Okay. And it is actually divided by this, you can see sternal plane. This is a line, and this line is actually at the level of your lower. Now this lower body of your T4 vertebra, you can see this is your vertebra. Okay, so this lower body is actually dividing this and this classification is dividing this mediastinum into two parts. So above this line there will be your superior mediastinum, okay, and below this line there will be your inferior mediastinum. Okay, so you can see this much area is your actually superior mediastinum. Okay, and this, from this line to this much area is your inferior mediastinum. Okay, so this much is clear. So this is actually the division on the basis of this lower body of T4 vertebra and the level of your manubrium of sternum. Okay, from this to this sternal plane is drawn, which will be dividing this mediastinum into superior and the inferior mediastinum. Okay, so I'm writing it here like this. Just consider it as, okay. So here will be your superior mediastinum. First of all, superior. I'm writing mediastinum in short, and this one will be your inferior mediastinum. Okay, this much is clear. Now this inferior mediastinum is further divided into three divisions. Okay, three mediastinums, further three mediastinum. Okay, so this is another classification. Okay, so now you can see this much area was your, below this line is your inferior mediastinum. So you can see three different colors here, the blue one. So you can see the sternum. So this area is actually your anterior mediastinum. So this area is actually your, so blue one is actually your, blue one is your anterior mediastinum. Anterior inferior mediastinum. Simple language, because it is a part of your inferior mediastinum. And this one is actually your middle mediastinum. Okay, so this you can see this orange, which actually is a pericardium or heart will be there here. Heart, pericardium is the outer covering of the heart. So heart will be present. So just anterior to this pericardium will be your anterior mediastinum, and posterior to this pericardium will be your green part, will be your posterior mediastinum. Okay, so this you can see this green part, full green part from here to here is your posterior mediastinum. Okay. And this orange part is called as middle mediastinum, in which your pericardium or heart is present. Actually, pericardium is there. Okay, so this is your middle mediastinum. So this much is clear. Okay, so I'm writing it here. Your anterior mediastinum, middle mediastinum, okay, and your posterior mediastinum. So so this was the classification. Okay, so I think it is clear. So this red one is actually your superior mediastinum. Red one is your superior mediastinum. Okay, and further full, including all the three, is your inferior mediastinum, and in that there is anterior inferior mediastinum, middle inferior mediastinum, and posterior inferior mediastinum. Okay, so this is actually a clinical classification which we use in the, when we see X-ray of any patient in the lateral view. Okay, so then we use this classification for any diagnosis. Okay, so that is why this classification is called as clinical classification. Okay, so I think this much is clear. And in the section of topography of mediastinum, so now you can see topography is very simple. In this diagram you can see everything. Okay, so in the simple way I am telling you the basic topography for your mediastinum topo. Okay, So in this diagram, you can see, first of all, we will be talking about anterior side. So you can see this is your sternum. Okay. So anteriorly you can see this is your anterior side. I think this is your anterior side, and this is your posterior side. Okay. A person is standing. We are seeing that person in the lateral view. So this will be anterior side. This will be posterior side. Okay. So anterior, you can see this is sternum. So simple sternum. Now posterior is your vertebral column. Okay, from level of T1 to T12. So posteriorly, so I'm writing it here anteriorly. Now posteriorly is your vertebral column. Okay, from T1 to T12 vertebra. Okay, now on the you can see inferior side. You can see this is your there is your diaphragm. Okay, you can see this is your diaphragm. So inferior side, there is your diaphragm. Now superior side, you can see this is thoracic inlet. So superior, there will be thoracic inlet. Okay, and now on the lateral side on each side, laterally, you will see the mediastinal pleura. Mediastinal pleura. So in lungs, they are actually, the pleura is a covering of the lungs from all the sides. Okay, so the covering which is present in the that is towards the mediastinal side, that covering is called as mediastinal pleura. So just see this basic diagram I am telling you here. Okay, this is your lungs. Okay, so between them there is a space. So this is actually a space which is called as mediastinum. Okay, so the covering, this is the outer covering. Okay, so just consider this as outer covering. Okay, I'm taking one lung. Okay, now so this covering, so this one side is actually your mediastinal pleura. So this pleura is actually just a layer outside your lungs. So this is actually your mediastinal pleura, and the pleura which is present just here is your diaphragmatic pleura. In lungs you will study. Okay, so this is called as diaphragmatic pleura. So the pleura which is present just below this is your diaphragm. So the covering of diaphragm will be by diaphragmatic pleura, and above this there will be, this here will be your cervical pleura. Okay, so that is why we use the word mediastinal pleura specifically on the lateral side. Okay, so I think this was a topography for this mediastinum, and there is topography for each also at each level, but it is very clear. You can understand by this diagram only. For superior mediastinum, you can see anteriorly sternum, superiorly is thoracic inlet, inferiorly you can see this thoracic cervical line. Okay, and posteriorly from level of T1 to T4 vertebral column. Okay, vertebra, body of the vertebra. Okay, now comes the anterior mediastinum. For anterior mediastinum, again anteriorly sternum. Superiorly there will be your superior mediastinum, you can say, or this sternal plane. Posteriorly there will be pericardium. This pericardium is the posterior, and inferiorly diaphragm. Okay, laterally the same. Laterally in each part there will be same mediastinal pleura on each side. Okay, and now middle. Anteriorly there will be anterior mediastinum, posteriorly posterior mediastinum, superiorly superior mediastinum, inferiorly diaphragm. Okay, for posterior mediastinum, anteriorly pericardium, posteriorly body of vertebra from level of T4 to T12. Okay, and inferiorly diaphragm, and superiorly superior mediastinum or sternal plane, the posterior part of your sternal plane. Okay, so this is the topography for each part. Okay, and the basic topography I have told you for full mediastinum as this. Okay, so thank you, and next video we'll be seeing the contents. Do like, share and subscribe the channel.